Awesome. Welcome, everyone. Thanks for coming to the workshop. We're really excited to be here today and be part of the Hunger Free Communities Summit. Tell you a little bit more about the work we're doing and hopefully we'll spark some good Q&A there at the end. We're just really excited to be here and excited to have some time with y'all. And so we'll jump into some introductions. I will start with myself and hand it to Daniel here in a moment. But we work together as a nonprofit and corporate partnership to kind of scale some food as medicine work and beyond. So I hope we will be able to bring you some interesting and fun information today. But for myself, on the nonprofit side, I work at the Food Bank of Central and Eastern North Carolina. I'm our Healthy Opportunities Manager, and so I kind of oversee the day-to-day operations of the Food as Medicine pilot that I'll be talking to you a little bit more about today. Been in food banking almost 4 years now, but I have a background in documentary film, so it's just kind of funny how things lead you one place to another. But I'll let Daniel introduce himself.
Thanks, Alice. Hi, everyone. Really excited to be here today and to get to chat with all of you and to be alongside Alice. The Food Bank of Central and Eastern North Carolina has been a great partner for us for many years. My name is Daniel Riff. I lead the government and nonprofit operations team at DoorDash, which is a team that works closely with food banks, pantries, other nonprofits all over the country to provide a last mile delivery service. And so really looking forward to sharing our partnership in North Carolina with you all today, and specifically in the Medicaid space with the 1115 waiver, and looking forward to taking your questions as well. So I will hand it back to Alice to get us started.
Awesome. So I will be starting off giving you a little bit of information about this Medicaid pilot that we're working on here in North Carolina, just to give you some background. So next slide for me. Awesome. Perfect. Okay. So the name of the pilot is called the Healthy Opportunities Pilot. For the rest of the presentation, just for ease, I'm going to refer to it as HOP. But excited to be sharing with you because this pilot is unique. It's the first of its kind, and it's the first comprehensive program that we've seen in the nation so far to test and evaluate the impact of providing services that are non-medical through Medicaid, which is a little different from what we typically expect with Medicaid. But essentially, there's been a pilot created where there's 29 unique services across 4 sectors that Medicaid has worked with the Department of Health and Human Services to identify as services that would be of benefit to the folks that are enrolled in their plans. And there's, like I said, 4 sectors. So food, that's where the food bank resides. That's what we know best, and we've decided to stay there. But folks in the pilot can also receive services related to housing, transportation, and interpersonal safety. So the idea is that it's this whole person approach to being able to bring some really hopefully helpful services to high need Medicaid enrollees in the state of North Carolina. It's still very limited in terms of geography, but we hope at some point it will expand, and I'll get to that later as well. But really, it's just a great opportunity for us to strengthen the quality of services that we can provide to folks, but also the community capacity to do so. The idea is to really build up the organizations that can offer these services over time and really be able to ensure that we're able to meet the need as more folks become eligible and their plans become part of the pilot itself. But like I said, it's a member-centered service approach where hopefully folks can get referrals across all of the sectors that they need. And in theory, if folks are able to have access to nourishing food, a safe home environment, some transportation to get not only to and from the doctor, but work, and an emotionally safe place as well. The idea is hopefully that there would be less ER visits or less long-term hospital stays if folks can get the resources that they need to thrive in their own way. And Medicaid is doing their part to foot the bill and make it work. So we're really excited here in North Carolina to be given the opportunity to shape healthcare in our communities moving forward. So here's a map just to give you a little bit of context about exactly where we are operating. So like I said, it's still limited. We haven't seen a full state expansion just yet. But there's three different pilot regions here that you'll see on the map. The counties in green are those that we're serving here from our food bank. We serve 5 of the 6 green counties down there. We operate under, you'll see it says Community Care of the Lower Cape Fear. That's our network lead, and I'll tell you a little bit more about them in just a moment. But just to give you a little bit of geographical knowledge, and it looks like just a few counties, but many of those are rural and it spans hundreds of miles. So really excited to be talking about how we're able to cover that area with DoorDash and beyond. Awesome. So a little bit more background here to give you an idea of kind of who the key pilot players are here and how it all kind of fits together. So we start with the Medicaid prepaid health plan. Those are the payers. Those are the insurance plans that are managing the physical, behavioral, and social needs of their patients. Those are the Trilliums, the Blue Cross Blue Shields. I'm not sure where everyone's from here, but those are like your main Medicaid payers in your state. From there, we have care managers who work with these PHPs, the prepaid health plans, to identify the Medicaid enrollees that they would like to put into the program. So there's a list of criteria based on where you live, what your physical conditions may be, or what your health conditions may be. I can save that for anyone at the end that might have any questions. But the care managers do the screening piece. And work to create that eligible population of folks that we can serve through the pilot. And they are the ones who are there to understand the full need of their member, of the enrollee, what they need, what they might not have access to, and hopefully be able to prescribe services so that's no longer the case, and folks can have what they need to thrive. And so from care managers, we move into the network leads. That's kind of those umbrella organizations that operate in those the shaded pilot regions that I showed you on the previous slide. But those are the folks that connect the healthcare and the social service sector. So really an awesome setup that we have here in North Carolina, if I do say so myself, being able to have that kind of go between our organization pushing the food out and the healthcare sector, which is a place that is new for us, but being able to help us with compliance and capacity building, and they're able to manage the whole human service organization network, all of the service providers. They are the ones who come to us and find not only, what we can offer as a HSO ourselves, but be able to build the network so we have neighboring orgs doing similar work and how we can all work together to make sure that there's no gaps in our service area. And then we get to ourselves, who are the service providers, the HSOs. Most of us are community-based social service agencies, and we are the ones that are delivering the services directly to the pilot enrollees. In our case, it's a physical food box that we'll tell you a little bit more about too. Just kind of give a little breakdown of how we get to where we are can sometimes be a little bit helpful. So like I said, there's 29 services across the 4 sectors in HOP. On this slide here, I've put the 3 services that we offer. For today's purposes, I'm going to focus on the healthy food box service because that is one that we partner with DoorDash to provide. But just for anyone who was curious, food and nutrition case management. So kind of one-on-one virtual service that we are able to offer to members who might need a little bit of assistance beyond their food box, or just understanding, maybe they need assistance with a SNAP application or some other benefits application. We can actually bill Medicaid for units of time spent with the members to give them that one-on-one direct support and resources about the emergency food landscape, which is one that we are very familiar with. So we were in a good place to start offering that from the jump. And in addition to that, we offer a fruit and vegetable prescription, which is a twice per month big farm fresh box of food that's delivered directly to members. And then our healthy food box service, which is a weekly service that DoorDash is very important in us delivering to our community. So we can go to the next slide and I can tell you a little bit more about that one. Awesome. So here's a photo of some of the contents of one of our healthy food boxes. We currently have 3 unique variations in rotation. But just to give a little bit of insight on kind of what's in the boxes that we are delivering, you'll see some grain items. This one has pasta and some oatmeal. We have individual applesauce cups, some canned protein, fruits, veggies that are all no sugar added, no salt added, or low sodium, some dairy items, peanut butter, and what have you. But the idea is that folks will be able to receive one of the 3 boxes we have in rotation on a weekly basis for either 3 or 6 months at a time. It's very similar to what you might expect, with a medical prescription, but for food. And those referrals come to us already assigned for pickup or delivery, most of which we see our delivery, which I'll get to here in a moment as well. But just for context, there's 2 allocation sizes. So those care managers who are working with the PHPs can work with the members who are to receive the food and learn a little bit more about their household size, their needs, what have you, and prescribe the appropriate allocation size to the family. A small box is intended to offer 2 meals a day for 2 people a week, and a large 2 meals a day for 4 people per week. The boxes that you see featured on the screen, you'll see that all the items are shelf stable. The idea is that this service would be referred with the fruit and veggie service as well. So we wanted to maximize as much as we could to be put in the pantries of the homes of the folks that we were serving, while also being able to offer the fresh component with the fruit and veggie prescription. So these are shelf stable, but they were designed by our in-house registered dietitian to be used in tandem with the fruit and veggie prescription as well. Awesome. So now we get to the fun stuff. How do we get it to the folks who are intended to receive the service? So this is where DoorDash comes in. And like I said, over 99% of the referrals that we get are prescribed for delivery. And so we very quickly, early in the pilot, understood how important it was going to be for us to build a delivery first model to support the community. And like I said, we have a couple 100 miles here that we are able to, that we are called to cover with the pilot. And we knew very quickly that it doesn't make sense to serve someone 70 miles away on a weekly basis, going 5 different directions just from our location in Wilmington. And so we knew we were going to have to develop some sort of network of partners to help us get the food out. And so luckily at the food bank, our model already had been functioning with the partner agency model itself. And so we were able to work with our network engagement team who works with those agencies every day in the soup kitchens, pantries, shelters, after school programs, what have you, to help us identify some partner agencies in our HOP network who had some capacity and some enthusiasm to take on a new pilot program. And then we were able to work with them to really build that delivery first model where we can go ahead and assume that if a referral is coming through, it's going to be for delivery. And we knew that we were not going to put up buildings in all of these places. There were folks already doing the work. How can we support them to help us push a different program out their door? And so really in an effort for us to be able to use as much of our own funding and reimbursement from Medicaid for the food and keep overhead as low as we could, working with DoorDash has been an awesome solution. Food bank models do not always include direct to customer or direct to recipient services. And so we're deviating quite a bit from our traditional food bank model. And we knew we were going to need a creative solution. And DoorDash has been just that. Essentially, like I said, we've been able to deliver these boxes across our vast area, which I'll get to here in just a moment, through these distributions you'll see here featured on the slide. We are able to roll our boxes outside and set up our deliveries with Daniel's team through the DoorDash portal. Very easy with case management to be able to take the documents we're already using, drop them into DoorDash with only really the information that they need to get from point A to point B. So we're able to keep information very, very safe and be able to reach a very, very large area. By being able to rely on our local DoorDashers who are assigned these orders when they're online, running from point A to point B, all over the areas that they're already working in. So we've been able to really expand our capacity and be able to not only keep up with the need and the referrals that are coming in, but also have some foresight kind of into what's next. So I think that takes us to our next slide here. There's a couple of pins on the map that show our 8 different delivery hubs across our region that we are using to deliver boxes via DoorDash. When we first started, we were delivering 10 to 15 boxes a week. Now we're seeing that number is upwards of 350 to 400 a week. And we're able to really sit pretty nicely between that 1,100 and 1,300, monthly total of deliveries using DoorDash. So being able to be strategic in where we place these kind of satellite locations and being able to rely on DoorDash to get our boxes out has been really great and really allowed us to create some plans, not only for the future, but for those that we're already serving to be able to expand our capacity. It has allowed us to not have to hire full-time employees every time we take on 50 more cases. We're able to rely on DoorDash to be able to help us get those boxes out. And they make it very, very easy, very user-friendly, and the cost for the deliveries is very doable. We're in a good spot with our reimbursements from Medicaid to be able to cover that, the food cost, and that of our staff. But that would not be the case if we were not able to use DoorDash. We would be very limited on how many folks we could serve. As much as we love to employ more people here at the food bank and grow, there is a limit on how many deliveries one person can do, especially when spanning that large of a geographical area. So being able to work with DoorDash to really share that responsibility has been huge for us and really has allowed us to develop a growth lens and a growth mindset. But very cost effective, very easy to use as well, and very thorough in the documentation in terms of the boxes getting where they need to go as well. So there's really a closed loop there when services are delivered. And so really grateful that their platform, software, and initiative really all fit what we needed. So continuing to work with DoorDash is truly a no-brainer on our end. So excited that y'all will get to hear a little bit more about that. But before I hand it to Daniel, tell you a little bit just about our neighbor experiences with home delivery. The reason we do what we do is for the people who are receiving the food. And that is kind of what keeps us grounded. And so we're able to, we work closely with the neighbors, even if it's not us delivering. We have the great folks at DoorDash that are doing so. We've received many testimonials from many folks just saying that home delivery has been immensely helpful. It removes a transportation barrier if there's one there for the recipient of the food. Saves some time. It's not another place that you have to go after you get off work to get food. If you're entitled to the food, which everyone is, like everyone needs food to live, nutritious food, even better. But not having to add it as another thing that someone has to do when they already have a busy life or they have a lot of things going on. Maybe they have kids, what have you, to be able to come home to the food on your porch or, just be able to quickly pick the box up when it's delivered has been immensely helpful to a lot of our folks that are maybe homebound as well. And with the food that's delivered, if folks are able to get to the store, then they can stretch their food budgets a little bit further. When they do get to go to the conventional grocery store, if there's some things you don't have to buy, you can use the money for something else. And so with that kind of hopefully increased creativity at mealtime, we also include some nutrition education resources to support that. So not only recipes to complement what's in the boxes, but also maybe handouts about keeping fruits and veggies fresh, like you see here on the screen, or how to use juice or reduce sugar intake, or maybe some things that we hear that our community are interested in learning about. So we have thankfully also a very robust nutrition team here who develops these recipes and handouts, and we're able to put those in the boxes when they go out every week. So very, very happy that we have all the pieces that we need, but truly it could not be done without DoorDash. We would be in a much more limited space. So very grateful for the partnership, not only with Daniel and his team, but our local Dashers as well. There has been an overwhelmingly positive response from the Dashers who pick up the boxes. They always share that they're happy to do it. And it kind of adds a different aspect to their day-to-day with the DoorDash deliveries, but folks really do show up and they want to show up for their community. So I'm really grateful that we're able to kind of bring people together Sometimes the Dashers know each other, who knows? But we've had some pretty funny things happen at distributions. But there is a really great sense of community around it. And I've just been very, very excited about this partnership and what's to come as we look toward expansion, hopefully to our whole state here soon. We're waiting for our Medicaid waiver to, well, it's been extended, but we're waiting for extra details. So hopefully more to come if we ever connect in the future. But definitely excited and in a really good space and feeling confident with that expansion, knowing that we can rely on DoorDash to get the boxes out too. So very excited about that and happy to hand it over to Daniel here to tell you a little bit more about Project Dash.
Awesome. Thanks, Alice. And just before I jump in, I see we have a few quick questions in the chat just about what's in the boxes. So maybe we can take those, and then I'm happy to dive into Project Dash a little bit more. Can you speak to where you source the items and if there's any level of choice or if they're all standard boxes?
For sure. So we source the items from a vendor that we currently work with to source some of our other like purchased product here at the food bank. They're located, I believe, out of state, but they're soon moving to our state. But we're able to source from basically like a wholesale purchaser. And then they are able to actually also pack the boxes for us. They created a few of our other more standard boxes. So we had a pre-existing relationship with them. I believe their name is Value Added Foods. So we had a pre-existing relationship with them and then have been able to change up the menus and adapt them to this pilot, which was really great. And in terms of choice, we're working on that currently. There are some guidelines that we're waiting with that expansion and extension of the 1115 waiver that makes all this possible. So there should be some increased guidance there on what goes in the boxes as time rolls on. Sorry, I just lost the question. There it is. But for right now, we're just rolling with our standard boxes. If there's something in the boxes that a member says that they're allergic to or just like really did not like, we can on like a case-by-case basis change up a little bit what's in the boxes or give an alternative. You know, if someone's allergic to tuna and they would rather have chicken, like we can make that happen. We want people to be able to use the food as best they can. But that was a little bit of the reason that we wanted to have multiple boxes in rotation each week. So there's a menu A, B, and C. So no one's getting the exact same box, 2 Mondays in a row. It'll, be that fourth week where you see the box A again. So doing our best to keep up, with also just the desires of folks who are getting the food. We all have different tastes and we all have different needs and things that we look for at the store. So hopefully we can expand, if we are meant to keep a standardized box, maybe we can have 2 or 3 more in rotation so people only see the same box a couple of times for their prescription. But for now, that's kind of where we are. And we hope that co-referred fruit and veggie prescription helps as well to be able to diversify some of the meals that folks can make from the food that's in the boxes.
Great. And I know we have some more questions coming in too. I think we'll take the rest of them at the end. But please feel free to add in any more in either the chat or the Q&A. We see both. So thank you for adding those in. I will just share a little bit more about Project Dash and about DoorDash's role in this space. Really excited to work with Alice and the team at the Food Bank of Central and Eastern North Carolina. We on the HOP Healthy Opportunities pilot. We also work with the food bank on their CSFP, Senior Food Box program, and doing home delivery for that program, and even with some of the partner agencies in their network that we do delivery for as well. This food bank is just one of the many that we work with across the country. So would love to take a few minutes to just talk about how we work with food banks and other nonprofits, and what that generally looks like, some interesting things that we've seen take shape across the country, particularly in the food as medicine space. So at DoorDash, we have an overarching belief that delivery is essential. In the government and nonprofit space, we believe that it is essential to help food distribution programs succeed and reach people who are the hardest folks to reach in your communities. And so in the way that we work with government and primarily nonprofit agencies directly is that we allow those organizations to tap into the DoorDash logistics network to fulfill deliveries. So as Alice talked about, in the case of Healthy Opportunities pilot, she knows who's enrolled in the program, she knows which site they're getting a distribution from, and she has DoorDash take care of the point A to B to get the food directly to someone's doorstep. We see this clearly increase equitable access to resources. We also see it really reduce stigma in a lot of cases. We actually just released a report yesterday on how some of our partners serve college students, where stigma is a really huge barrier, and delivery is a way that those students are much more comfortable accessing food. And also, as Alice mentioned as well, relieving pressure on staff and volunteers as well, with a pretty easily scalable option. And so we work with a lot of nonprofits across the country, and I lead a team that is really focused on supporting these organizations. DoorDash works with restaurants, as you may know. We also work with grocers, we work with pharmacies, we work with retailers, and we work with nonprofits. And so we try to understand the needs of our nonprofit partners and develop products essentially that serve those needs. And so we have delivered more than 100 million meals all over the country through this initiative in the last 6 years. But it is also not just meals. We deliver diapers, we deliver clothing, whatever it may be. And just in terms of kind of the breadth of it, I know Alice spoke to the rural nature of some of their HOP service area in those counties. That's pretty common. So we support organizations all over the US. The little blue dots are places where we've done at least 50 deliveries for Project Dash. And this goes for urban areas, suburban areas, rural areas. We have a partner, we work closely with Mountaineer Food Bank, for example, in West Virginia, where they serve counties that don't have grocery stores. And so they will drive a truck out, park it, and have Dashers come and pick up from there and deliver to households in that community. And we really kind of follow the lead of our partners in figuring out where delivery is helpful. With Central and Eastern North Carolina, we started on the CSFP Senior Food Box Program. That was the origin of our partnership. And then, Alice and folks at the food bank thought, okay, maybe we can plug this into this other effort, and plugged it into HOP. We've seen partners, use it for disaster preparedness, disaster recovery. It really is a really wide range. Sometimes it's groceries, sometimes it's prepared meals. We have a national partnership with Meals on Wheels America, where we often supplement their volunteers when they have volunteer gaps. And so we can help ensure the folks they're serving still get food without it needing to be the full-time staff who are leaving their desk and doing deliveries. Um, and it's pretty flexible in terms of the range. You saw the 8 locations where we do the HOP delivery in Southeast North Carolina. And then, folks pick up from trucks and vans as well. And we just need 1 hour's notice to do deliveries. So I want to get into the healthcare space a little bit, and also talk about the broader, 1115 space. So um, many of our food bank partners and other nonprofits use us as a last mile service for healthcare partnerships. This is increasingly common. I would say, probably the majority of new partnerships we've seen in the last year or so have been tied to a healthcare partner in some way. A couple examples of this: one in Stockton, we work with the Emergency Food Bank, where they get referrals for patients with diabetes, and then they get essentially prescription food bi-weekly delivered. And that was a partnership with a food bank and with Abbott as well. And they saw a significant improvement in A1C levels for folks that were getting the delivery. When we're talking about delivery in the food as medicine space, we're really talking about adherence to the food prescription. And so that is something that is dramatically improved when you remove the transportation barrier. Similarly, we work with Food Bank of the Rockies. They work with their local hospital network to identify patients with risk factors, and then get food boxes weekly with DoorDash. This morning, I saw an article on another Project Dash partner that is partnered in Washington State with their local hospital, and they just launched a program for folks that screen positive for food insecurity. So we're really seeing a lot of these partnerships across the country. And with Medicaid funded programs in particular, we just talked through what this looks like in North Carolina. We work with several other HSOs, the term for the nonprofits that are providing food services under the Healthy Opportunities Pilot in North Carolina. We work with currently 3 other HSOs in North Carolina to do home delivery for their healthy food boxes as well. And North Carolina, hopefully is the first of many states where this reality this becomes reality. We are already working with entities in California, nonprofits in California that are through CalAIM able to provide food and be reimbursed for that service. We are also, eagerly anticipating the implementation of the 1115 waiver in New York, which happens Jan 1, and working with nonprofits that are planning to provide nutrition services under that waiver. Massachusetts is another big area of focus for us. There are other states in this list where we're also actively working with organizations. If any of you are in these states or in states with that are nearing implementation for your 1115 waiver, we would love to see if we can support and help scale your services. As Alice mentioned, it's really all delivery in terms of the referrals that they're getting. That's the method that folks are being prescribed, and that can be tough to fulfill if you need to kind of scale up a delivery infrastructure. So we would love to help. And then I just wanted to quickly speak to our platform generally, and I know there was a question in the chat around HIPAA training, so I can take that too. Partners tap into our platform at a discounted rate. We have standard discounted rates for nonprofit partners, generally around $5 a delivery. Happy to talk to you about more in detail about what that looks like and certain options you have in addition to that. But really what you're able to tap into and what Alice and team are tapping into is the existing DoorDash infrastructure that exists in your community to be able to fulfill your deliveries. And so you can see the real-time tracking of the delivery. Your clients can receive text messages about the status of their delivery. There's a lot of data protection on this platform. So in terms of the HIPAA question, our platform, the one that our nonprofit partners use, is the same platform that Walgreens uses to deliver prescriptions. So there are a lot of safeguards around data protection here. In terms of HIPAA, so when Dashers are delivering these types of boxes or bags, they do not know the contents of the boxes or bags. They are just delivering this box from this pickup location to this person's address. And so it is much more similar to a FedEx or a UPS in terms of just being a pure delivery service than being a volunteer who might be helping to pack it and maybe is going in and doing a wellness check. What the Dasher is doing is just the point A to point B. So we essentially operate as a conduit. And so the HIPAA regulations do not apply to the piece where we fit in. But we do background checks on Dashers who do any DoorDash delivery. And again, we have a lot of data security protection in place. All right. I think that is all we have in terms of the presentation. We're aiming for 10 minutes for Q&A, and I think we nailed it. So we'll start with the questions that we have in the chat. Also, we just have our emails up here if you'd like to reach out. I know we answered the first 2 questions from Jennifer and Jody. I think I answered Paula's, but I also know Paula had another question in the Q&A just asking around nutrition standards. Alice, you may have addressed this, but just anything you want to add around nutrition standards for building the boxes?
We kind of adhere to right now, while we don't have specific guidelines from our network lead or from Medicaid and DHHS currently about exactly what needs to be in the boxes or percentages of how much of this type of food and what have you. We adhere to our own internal nutrition standards. And those that we adopt when working in any of our traditional healthcare partners that we have that like kind of screen and intervene, leave the hospital with a box of food partnership. It's a little out of my wheelhouse, so I don't want to misspeak on any of the work that any of the folks at our organization are doing. But the no sodium, low sodium, fruit in 100% juice, try to keep the foods as whole as we can. And some high protein items, some whole grains, things like that. Hopefully, when we get more information about what the next kind of iteration of our 1115 waiver looks like and what the guidelines for our service are, they will be shared online. So I definitely recommend keeping an eye on HOP and just the HAPs around North Carolina, because all of our information is put out there as a network, which could, help form some conversations where you are too. So I know that's not the best answer to your question, but that's what I have currently. And Paula, I saw your question too about what happens if the recipient is not home. So right now, with our boxes being shelf stable, works really well, where dashers are able to leave the food and take a photo, and it is uploaded into the portal. So I can go and check, if someone calls and said, hey, is my box at home, or I'm on my way home, is it there, or my box isn't there, what happened? I can show them that maybe it was, set up on a chair or something like that. But our success rate for deliveries with DoorDash is extremely high, like almost perfect. So if they're not home right now with our boxes, that is totally okay. And it works within the DoorDash model. But hopefully, if we move forward to include more fresh foods in our boxes, we would just work with the neighbors to make sure that we deliver it at a time when they would be home. And with that easy to use portal, we would be able to stagger deliveries, throughout the day for maybe a member that would prefer to be home. But very easy to do with DoorDash. You just get to change the times, which is great.
And Anna, just to speak a little bit to your question or your comment around the senior home delivery program. So great that your food bank has a home delivery program. Understand that you have a limitation with drivers. Many of our partners do use our service as a supplement to whether it's volunteers, whether it's staff drivers, whatever it may be. Even if it's a temporary supplement while you sort of scale up your driver capacity. It is pretty flexible. We also have organizations that, if a couple of volunteers don't show up, call out sick, whatever it may be, then it's just DoorDash that takes the deliveries that day. So again, like sometimes we are the primary means, like we are for Alice and team, and sometimes we're more of a supplemental option. And feel free to. Oh, sorry, Alice. Was there something else?
No, you're fine. I'm just looking through the questions, trying to keep up. You go ahead.
Are there other questions that you're seeing?
I'm seeing a bit about reimbursement for us. I can take that one. So
great.
The food bank is being reimbursed by Medicaid, but with that network lead that we have, kind of that umbrella organization that goes between the payer and ourselves, our invoices that we submit get sent through the network lead's like internal finance department and then to the payer. So if there are rejections or items like that, or issues with remittance, we're able to work with our network lead, who works directly with the PHPs. So it is Medicaid money, but we're not contracted directly with Medicaid. Our network leads are, if that helps. But we do like create the invoices and put them through the electronic system that they have for that. But similarly, the network lead is kind of the conduit to the PHPs. But yes, we do handle all of the logistics, and with the reimbursement that we do get from those individual claims, that's how we're able to keep the program sustainable. But we do handle the lifting of the logistics. And then I see one about here, how long between the waiver passing and able to leverage the waiver for reimbursement. So our waiver passed actually in 2018. but then COVID. So services did not get rolling until 2022, March of 2022. So there was a bit of a stall. And then when we were able to come back online as a whole network and come together, services launched in 2022. So I don't think we're like the best example because we had the COVID pandemic in there. So in terms of real time leveraging, I don't think we're the best example, but we did come out of it and we were ready to go in 2022 when services launched, which was great.
Awesome. And I can Savannah's question around, a lot of Project Dash partnerships are involving a pantry, food bank network, and a healthcare partner, and what types of healthcare partners that are beneficial. Happy to speak to that. And I will also just say most of our Project Dash partnerships do not involve a healthcare partner, but we are just seeing a lot more interest now from organizations that are working with a healthcare partner. So the most common program that we deliver for is the CSFP USDA Senior Food Box Program. We provide delivery for that in over 20 states, work with many local partners. But it really looks different from partner to partner. But on the healthcare side, I would say I've seen a couple different models emerge. One is the Medicaid model, which we've talked through a lot today, in states where there are 1115 waivers and food banks can get referrals through that process. We're also seeing more partnerships where it's a food bank or pantry and a hospital that is doing social determinants of health screening. I know there are various requirements around doing that screening and referring out to a food providing partner if the patient screens positive for food insecurity. And so we're seeing some cases where the hospital will partner with a food bank or a network of pantries to then fulfill those referrals. And we're also seeing that there is more attention being placed on those being closed loop referrals, where there's actually follow-up to make sure something is happening there. But one model is hospital screens patient screens positive for food insecurity, is referred to a food bank or pantry, and if the patient cannot get to the food bank or pantry because they're recovering from a procedure, or because they don't have access to transportation, or they're homebound, then they're essentially enrolled in home delivery from that pantry or food bank. Definitely the ideal model is that the healthcare institution is also helping cover the cost for that delivery as well, because it improves patient outcomes. So we're seeing that happen in some places too, although I know there are a lot of different models in terms of where the actual funding comes from. Wonderful. Well, thank you everyone for taking the time to listen. Really happy to share this partnership with you all. Alice, anything you wanna wrap with?
Just thank you, echoing what you had to say. Please feel free to reach out to me if you have any more questions just regarding HOP, this partnership, or just what it's like working with these kinds of waivers.